Hello everyone, I'm Dr. Mobi, board certified in sleep medicine, family medicine and hospital medicine. And today's topic I'm going to talk a little bit because we are getting a lot of questions about COVID and a lot of concerns in my patients about COVID and role of sleep problems with COVID. So some things I would like to highlight. First is, we are seeing a lot of insomnia, which is inability to fall asleep or remain asleep more than 6 months. And it could be short term too, which is less than 6 months. And the other problems we are also seeing is lot of also worsening of sleep apnea. And that is happening because of the weight gain and referred as COVID pounds or COVID obesity, and that is roughly 10 to 20 or maybe 30-pound weight gain, and that is making worse. If you didn't have sleep apnea, then people can develop sleep apnea, and that is obstructive sleep apnea, and you can have both disorder, insomnia and obstructive sleep apnea. And other problem we are seeing also with long haulers or people who contracted COVID and then they recovered, they were having a lot of problem with also hypersomnia or excessive sleepiness, inability to actually function during day and having chronic fatigue or fatigue-like syndrome. So I'm going to talk a little bit one by one on that. So insomnia is, as we discussed, inability to fall asleep or remain asleep. We were seeing anywhere from 20 to 30%, even more in certain studies, in Chinese studies, in Turkish studies, and also they have seen excessive problem with healthcare providers even themselves because of underlying stress, or also problem with, if you have mood disorder, they got worse. So anxiety, PTSD, depression all got worse, especially also because of our social isolation. It made it worse. And also we were seeing delayed phase syndrome or delayed phase insomnia, where people were having hard time waking up early morning. So those are some of the disorders we were seeing, and the treatment for that short term we can give some medication, but very important is to take care of any alcohol abuse. So try not to use that to self-medicate because that's not going to help your insomnia. Other things you can do is to improve relaxation, do some relaxation techniques at home. That is certainly going to help to reduce some of the anxiety and stress level. And gentle walk is very good, and also try to adopt good habits, which means try to have a discipline falling asleep and remaining asleep time. Try not to do too many things in the bedroom which are counterproductive. Also, there was also problem with TV. People were on social media and watching TV, and they were having a lot of anxiety because of either they're seeing their loved one passing away, or there was a concern on just COVID by itself. So that really made it worse. Other problem we talk about is obstructive sleep apnea, and that is because of the weight gain that could manifest as worsened of sleep, snoring, sleep problems such as sleep apnea, sleepiness during day, and that was seen also worse. Other issues which I see, people who already had sleep apnea, they had hard time using their CPAP unit, and they should see this doctor and get proper care. So sometimes we need little adjustment and reevaluation whether the pressure is worsened or not. Other thing we were seeing is hypersomnia or excessive sleepiness, and I'll talk a little bit on that. We were seeing a lot of narcolepsy also, and that we study by doing two studies overnight to first see if you have sleep apnea or not. And the second is if you have daytime sleepiness manifestation, as doing nap studies. And we were finding some problems with that. And if you are appropriate candidate, of course, then we will take care with medication beside if you need CPAP or not. Other issues we were also seeing is circadian rhythm disorder, and that is where your internal rhythm is not following your external rhythm. So that happens also sometimes if people are in the hospital or they are more indoors or because of social isolation. Normally sunlight helps us to entrain our body or coordinate internal rhythm with external rhythm, but because of the problems with COVID we were seeing, they were having circadian rhythm disorder. Melatonin was used in ICU and it was helpful for some. For short term, they were using some medications to regulate the sleep disorders. So make sure, stay safe, get help from the medical provider, discuss your case because your situation could be unique. So in the end, again, I repeat, there were 3 or 4 major problems we were seeing. One is insomnia, or sometimes referred as COVID insomnia, and that is inability to fall asleep or remain asleep. Second one was also with circadian rhythm disorder, and the third was sleep apnea, obstructive sleep apnea. Fourth is hypersomnia or excessive sleepiness. Make sure get help and get treated properly. Thank you for watching and listening. Take care.